Hello and welcome to this video on cannabinoid oils, which are more commonly called CBD oils. These can be derived from either hemp or cannabis. It does not have the psychoactive ingredient from cannabis called THC or tetrahydrocannabinol. CBD oil is a therapeutic agent with swiftly growing interest. Despite this, only a few countries have legalized it, and for very few conditions. The most common and recognized diagnoses for which CBD is approved is epilepsy in children. Other uses lack research of adequate quality for CBD oil as a treatment. Unlike THC-based medications, CBD can be purchased and used without prescriptions in some countries. It is used for pain relief and anxiety in a non-prescription format, and for seizures as a prescription. Doses can be anywhere between less than 62 micrograms to over 3,000 micrograms a day for an adult. The active ingredient in CBD oil is called cannabidiol, as distinct from the psychoactive cannabinol and cannabinoid. The latter two are psychoactives and create the sense of euphoria and relaxation characteristic of cannabis use. CBD oil is not like this in that it has a poor capacity to influence and affect the receptors the psychoactive compound act on. There are two major cannabis extract targets. These are called CB1 and CB2 receptors. The type 1 receptor, or CB1, are found primarily in the central nervous system and in adipose tissues. There is further evidence that they can be found in endocrine organs. Type 2 or CB2 receptors are primarily found in the peripheral nervous system and, interestingly, on immune cells. CBD oil has a poor affinity for these receptors. In fact, CBD oil is an antagonist, which means it blocks the receptor from functioning. There are several pharmaceutical preparations of CBD oil currently available, and most of these are patented products. An example of this is nabiximols, also sold under the name Sativex. It contains both CBD and THC. The drug was approved in Canada in 2005, specifically for neuropathic pain in multiple sclerosis. This was extended in 2007 for cancer-related pain. Another product called Epidiolex is an orally administered CBD oil solution and was approved in 2018 in the United States of America for two forms of childhood epilepsy. The safety and long-term efficacy of these drugs have been the subject of investigation. In general, there are very few side effects, and certainly no worse than the placebos were found to have. The most commonly reported examples include dizziness, confusion, headaches, and fatigue. Considering its low incidence of side effects and the specific examples given for use, the biochemistry is interesting. CBD bioavailability is not great, especially when taken orally. It has between 13 and 19% availability. This means that for every 100 milligrams taken, only 13 to 19 will actually get to a receptor and work. When taken as an inhaler, it has 11 to 45% availability. The average is about 30% when it is taken as an inhalation. This means that between 87 and 55% of the CBD oil taken is passed out of the body as waste. Despite this, CBD has a half-life of 18 to 32 hours. The modal concentration of CBD in THC-focused medications is 7 milligrams per milliliter. The amount of THC is slightly lower at a figure around 5 mg a milliliter. Specific CBD oils have approximately equal parts of THC and CBD at 2.7 and 2.5 mg of each in a dose. This is consistent with most prescription medication that has a 1-to-1 ratio of active compounds. Over-the-counter or non-prescription versions of these have substantially lower concentrations. There is strong evidence that there is a sex difference in the function and effect of cannabinoids in the human body. The endocannabinoid system is the primary mechanism for this, and it regulates things like behavior, sexual activity, food intake, motor function, and more. The brain has a concentration of the CB1 receptor, and this results in a lot of endogenous cannabinoids and enzymes involved in their metabolism being affected by sex hormones. As a result, men are generally more likely to be addicted to cannabinoids, but women are more likely to be immediately affected by them. The two major metrics of CBD medications, that being both the concentration and whether or not they have a THC component, has an effect when you are evaluating the clinical benefits. THC is a definite psychoactive. CBD is not as clear-cut. Further to that, distinctions in the dosing is important, with similar concentrations of THC and CBD in some non-prescription medications. A 2018 study found that the anti-anxiety properties of CBD oils occur at the very low and very high end of the dosing regime. Doses of up to 300 mg produced anti-anxiety effects, but not between 300 and 900 mg. After 900 mg, it again provides an anti-anxiety effect. This represents a safety issue. CBD also plays an interesting role in this area, producing anxiolytic effects when administered orally, and has the ability to attenuate the anxiogenic effects of THC. This polarity will ultimately have an effect on whether or not CBD oils which contain THC can be used safely and effectively. A Cochrane review exists for cannabis use in Crohn's disease, which is an autoimmune condition affecting the intestines. The experimental group received cannabis with THC in it. The control group had the THC removed. When comparing this to pure CBD oil, it creates a viable comparison. The studies for this review were very small in size. The findings should therefore be taken with a grain of salt. One that had a high bias risk contained a 5% preparation of CBD oil. This found a 7% improvement in this group of 10 participants over the control group of 9. A better but still low quality study from the review with a lower bias risk used a 15% CBD oil preparation. The study had 50 participants who experienced a 16% improvement in quality of life. This was only a quality of life assessment, not a clinical remission study or finding other clinically relevant results. Overall, even a Cochrane review cannot find substantial evidence of CBD oil benefits for GI issues. CBD oil is sometimes used for multiple sclerosis, normally given the acronym MS. Each spray delivers a dose of 2.7 mg of THC and 2.5 mg of CBD. This is administered to the buccal mucosa, in other words, in the mouth. Patients with MS would take up to 8 sprays a day on average, and a maximum of 12. CBD was found to be as effective as complementary and alternative medicine for controlling the symptoms of MS. Unfortunately, this does not say much about the efficacy of CBD oil. Another common use for CBD is fatty liver and diabetes. The studies that examine this use low doses of CBD oil of 2.4 mg per kilogram of body weight a day. There was a lack of effect found in these studies. Chronic pain and CBD oil has been examined. Investigations have found variable evidence of its effect. Some authors have stated that the available medicinal formulations have a standardized dose of CBD and has little to no THC. This therefore eliminates the psychoactive effects, which is particularly important in the elderly, and improves the safety. However, they've also found limited and unreliable evidence of its efficacy. Perhaps the best known application for CBD is as a treatment for seizures. In 2018, trials showed the long-term safety and efficacy in children and adults with treatment-resistant epilepsy. A long-term trial is showing an update recently at week 144, using more than 600 patients, found that CBD may be effective treatment on a long-term basis for resistant epilepsy. This video does not and will not address the use of CBD oil in cancer, as it is a far wider reaching condition with many more variables than can be described in a reasonably timed video. A related point is that this video does not address all of the possible applications of CBD oil. Endometriosis, schizophrenia, and more are possible targets being explored, and there is a lack of a body of high-quality evidence from randomized, blinded, controlled crossover trials to support any argument one way or the other. In summary, CBD oil has very limited evidence for its use and is plagued by the dual problems being both a prescription and non-prescription drug, with a wide variance in the concentration of active compounds. It likely has a substantial placebo effect, but that is not medicine. The current evidence for CBD oil is lacking for many conditions, and despite approvals for its use as a prescription medicine, it may not demonstrate an appreciable medicinal effect for many conditions. Thank you for watching this video. If you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions below.